This is Steve Zeltzer with KPFA WorkWeek Radio, and I'm with Carolyn Malloy, and she's come to this conference here, and she's an expert on the NHS and the fight to protect it in Britain. Welcome to WorkWeek Radio.
Thank you, Steve. Hi.
You're here at this international conference on healthcare workers. It's quite a conference. Why don't you talk about what you think about this conference, what's been happening here?
I'm blown away by this conference. It's really exciting. Yesterday we took to the streets, It was interesting to see the reaction we were getting because we were marching for Medicare for all. And people around seemed to have a really positive reaction, and the passers-by on the streets and were smiling at us. And the police seemed quite enthused as well. I guess they have some of the same issues. So, yeah, that was really inspiring. And the extent to which they brought in all the other political issues. So I'm here, I suppose, particularly to listen to the stuff around Medicare for all, but they've also been talking a lot about climate change and racial equality and all of these kinds of things. And it's extremely political, which is wonderful. It's really good to see.
Pretty surprising for the United States. Is this a surprise for the unions? I mean, most unions are not this political.
I guess, I was saying to someone yesterday from an English perspective, if I'm allowed to mention the Trump word, when he got elected, I think actually the response to that we saw from Americans that were not happy about that for me, that slightly shifted my understanding of where American politics is at, the fact that so many people were so outspoken about how unhappy they were about this and then when we saw the stuff like Black Lives Matter, this kind of stuff. So I was aware that there was a resurgence of radical politics over here, I suppose. But to see it in a nursing union that is a surprise, actually, because that's not really, the unions back home, the main nursing union back home is not so outspokenly political as this, I would say.
And the National Health Service is under attack, privatization, and also there's some companies like Kaiser here which want to buy in or buy out the National Health Service, and in fact that's negotiation with Brexit. The United States is probably hoping Brexit goes through so they can make a deal with Boris Johnson to bring Kaiser in to modernize and make it more efficient than the National Health Service. What's your view on what's happening with the National Health Service and what needs to be done to defend it?
Yeah, like most people in the UK, I'm a passionate defender of the NHS, and it's been there for me when I've needed it, and it's also been there promptly when I've needed it, and it's been there, it's given me choices when I've wanted it. I don't mean choice of, what provider, just like choice over what I actually want to happen in my healthcare, So I'm a huge advocate of the NHS, but yes, as you say, it is under. I think a few years ago, someone from America, someone was over here in the States saying that the NHS was an unopened pearl. It's got a large budget, £110 billion. It's a huge opportunity. And what we've seen in the last couple of decades in particular is restructuring to enable those companies to begin to come in and pick off bits of what had previously been almost entirely state provision. And they came into some of the less glamorous areas of healthcare. So like now, particularly things like mental health care has been a lot of privatization. There's a US private equity-owned company. They bought out the Priory Group that runs a lot of the specialist mental health care. Some of the community staff is being bought out, not just by American companies, and this isn't new, but I think this is accelerating. There are definite, very real concerns about the impact of a trade deal, a post-Brexit trade deal. Trump came over and said the NHS is on the table for a trade deal, and then from the outcry, he had to kind of row back and say, oh no, I didn't mean that. But no one in the UK trusts Trump, really. He's the most unpopular US president in the UK ever.
And of course, there are 78 million people in the United States who don't have health care or have poor health care. I guess they would like the same for the UK.
I mean, it's yes, that issue of access. I mean, I've actually found it quite emotional here. Like, obviously, talking about healthcare is emotional, but the number of times I've been in tears hearing in the sessions, hearing people's personal stories. Healthcare workers who themselves, even though they've got some level of insurance, obviously, as healthcare workers, even maybe some quite good plans, including with people like Kaiser, who are probably not one of the worst. But the fact that they have to fight so hard for treatment for, kids with asthma, kids with diabetes, this is just not, that's not the way it works in the UK at present. And it's really quite devastating to hear some of those stories. Yeah.
It's pretty shocking in this richest country of the world with all these billionaires. You're here in San Francisco with the capital of billionaires around the world.
Yeah, it's devastating, and obviously I know this objectively and have read about it, but hearing it from people is a different story. And I think, what you also it's interesting to me that people have questions about the NHS, and they've obviously been, there's some big money going into funding messaging about how, in the English system you have to wait a long time. And actually, it's not really true. I mean, the waits are going up a little bit at the moment. You're generally seen very quickly for serious things, certainly. The waits are going up because so much money is now beginning to be creamed off, not even so much by the actual, the private companies. They don't really want to run hospitals. They want to just do little bits and pieces, and they want to do the back office stuff, and they want to be running the system. And that's where companies like Kaiser, companies like United Health, so the guy who runs the English NHS is a guy called Simon Stevens. He's an English guy, but he was the vice president of United Health for global markets or something like that. He is now running the English NHS. And the guy who was formerly our health secretary until recently, Jeremy Hunt, he told our parliament a year or so ago, he said, we want to find our way to the kind of budgetary arrangements that they have in Kaiser Permanente. And lots of English executives from the NHS have been coming over and visiting Kaiser. And
have they gotten the story in Britain about the situation in Kaiser, that Kaiser's been fined millions of dollars in California for not providing mental health appointments soon enough? Some people have committed suicide, that the healthcare is being basically destroyed by Kaiser because of their profiteering?
I don't know if they know that story. I mean, I guess they wouldn't have heard it from the Kaiser executives, and I'd quite like to ask you a bit more about that. But I mean, certainly, from my perspective, I can see that, maybe compared to some of the worst health plans, that Kaiser is perhaps slightly better. But from where we're starting in England, it seems a crazy direction to go in. It seems, more costly, less efficient, and I think one of the things that Kaiser seems to have done quite successfully, from talking to nurses here, is kind of market itself as being about prevention and being about wellness and helping people to stay out of hospital, But
Kaiser Thrive.
Kaiser, yes, exactly, all that stuff, all this good PR that they seem to be. And, what I'm hearing is that actually they're moving away from that. And, of course, it's true that prevention, prevention is not, this is not a new idea, but actually, there seems to be a huge gulf, both here and back home where I come from, between the rhetoric of prevention and actually the reality, which is get more gatekeeping, making access harder, sort of almost punishing people in the UK now for, if you're not looking after yourself well enough, if you smoke, if you're obese. Some areas are now actually beginning to restrict healthcare on that basis.
So these wellness programs, which you have to do this or you get punished.
Exactly. It's like more punishment and less reward is actually what's coming in. And meanwhile, in England, one of the things that's happening is they're cutting the kind of public health education, like losing weight classes, smoking reduction, all of that sort of stuff is being is being cut. So they talk the good talk about prevention, and I think Kaiser kind of appeals because it seems to have that message as well. But the reality is something completely different back home, and from what I'm hearing over here as well, that classes have been cut. People are left to manage their diabetes by themselves without proper education, unless they're the most acute cases, that kind of thing. So that's been really interesting to hear about that for me.
And this idea of internationalism, I mean, workers linking up globally, healthcare workers, you think that that's critical in an effort to defend healthcare?
I think absolutely critical, and I think it's fantastic. It's like I've been really struck by how similar the stories are. Like, we're maybe all at slightly different journeys in the path along the route to neoliberalism, or in a few cases away from neoliberalism. I mean, I was very inspired by I had a brief conversation with the Portuguese colleague, and she told me something that I didn't know, which was in the UK now, the right-wing politicians often say, as a way, they want to criticise the NHS, they want to detach us from our attachment to the NHS. And so they say, well, if the NHS is so great, how come no other country in the world has copied it, right? And the Portuguese nursing president said to me, well, Portugal has copied it. That's what we did after the revolution when we got rid of the fascists in 1970s. We explicitly modelled our system on the English system. So what your right-wing politicians are saying to you is not true. And not only that, but, Portugal, like many other countries, has gone down the path of neoliberalism and marketisation of their healthcare. But now, because they actually are one of the few countries in Europe with a properly left-wing government, they have reversed some of that stuff and passed laws to actually begin to more exclude private healthcare from all but, from their system, which is very inspiring to me, and this is what we need to learn from each other, as well as hearing about, the level of kind of international solidarity and disaster relief that nurses are going out to do. It's like one of the messages that's come really strongly through this, I think, that they're really emphasising here is, nurses' values as advocates for their patients, as advocates for healthcare for all, and that's kind of coming through in everything I'm hearing, which is really nice.